Hello, 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 everybody. Give me 1 second. I'm just trying to pull up all my chats. You know how that goes. Perfect. Hello, everybody. Welcome to the Sunday shift where we don't really have an agenda. We have nothing to talk about. This is just your time to come in, ask questions, whether it's ATITs related, nursing school related, nursing related. It doesn't matter what it is. This is your opportunity to come and ask those things. So I do get a ton of questions over on all of my social medias about what should I expect in nursing school? What should I do before I get in? What should how should I prepare for ATITs? What happens after nursing school? Does NCLEX actually prepare me to be a nurse? I get all of those questions over on my social media. So we decided to do something a little bit different. We decided to make the Sunday shift, and that's all about you and what it is that you are experiencing. So this is your opportunity to come and ask questions. We do this for about an hour every Sunday. And hopefully you are ready and rearing to go as much as I am. Hi, Stephanie. Hi, Mandy Bestie. Hi, sweetie. Hi, Jocelyn. Hi, Leslie. Somebody's taking their Hesse tomorrow over on the TikTok side. Kara takes hers in a month. Katie Ann, hello. Ayana. I passed my T's last Friday with an 88.7. First of all, huge congratulations to you. That is an incredibly competitive score. I'm so incredibly proud of you. That's great. Make sure you take time to celebrate. That's a big hurdle, right? You made it over that mountaintop onto the other side. So I'm so proud of you, Ayana. Congrats. How do I get over the fear of not being smart enough in nursing school? Great question. So, to be very transparent, because not everybody's nursing school's experiences are going to be the same, but I have heard a lot of the similar things when it comes to nursing school, is that you're going to have instructors, you're going to have maybe advisors, you're going to have somebody who's not necessarily going to believe in you. They're not going to believe in your skills. And then when you are already second guessing and doubting yourself, it makes it almost 10 times worse, right? Because you're in now a position where you're like, I don't feel like I'm smart enough and nobody else believes in me. So why should I keep pushing forward? Why should I continue to do these things if I don't feel like I'm going to be able to, if I'm not going to be able to be good enough for what it is that I need to do, right? So this is what I would say is that you really need to find that imposter syndrome and just push it away. And one of the ways that I do that is, number one, I don't do study groups, because study groups tend to make you feel iffy. If you get a good study group, you may be okay, but sometimes they make you feel worse, right? Don't read from the textbook, because if you try to read from the textbook, you're going to feel like you're not smart enough, right? Because the textbook is so lengthy and girthy and it's unnecessarily big, right? We don't need all of that information. Number two. And number three, when I'm second guessing myself and I have imposter syndrome, I always sit down and I figure out my why. So I have this same conversation with all of my preceptors. I have the same conversation with all of my nursing students. But really, you need to figure out what your why is. Why are you doing this, right? It's not that you're not smart enough. It's just that maybe you're second guessing yourself. So you need to figure out your why. If your why doesn't make you cry, it's probably not a good why. Find a why that makes you cry, because that is going to be the why that's going to push you through nursing school, right? When you are not inspired to study, your why is going to make you want to study. When you're concerned and you feel like you're not good enough, your why is going to make you feel like you're good enough, right? Because at the end of the day, if we can't support ourselves, we can't expect somebody else that's going to support us too. So I think that would be my biggest thing to you, is what I would say is find your why and push forward. I think that you're going to be amazing in nursing school. It's just that you've got to get over that second guessing and that overthinking. Best way for study when it comes to reading on the T's, I pass all subjects besides reading for my program, really struggling. My biggest thing when it comes to reading on the T's is read the question first. That's going to be my biggest thing, because at the end of the day, if you are trying to read the passage, then read the question, guess what? You're already going back to the passage a second time to try to find the answer to the question. Read the question first. The question is going to tell you where to look. Number 2, if you're just struggling and you just cannot figure it out, do process of elimination. There's usually like 2 answers that just don't make sense. Eliminate those 2 answers and then go with which one your gut's probably telling you is most correct. And don't change it unless you know with 100% certainty that the other answer was correct. That's my biggest advice when it comes to reading. Which class was the hardest for me? To be honest, in nursing school, my hardest class was peds. Pediatrics. And the reason why is because pediatrics is very different from adults. So adults, you've got one set of vital signs, you've got one particular set of things that you need to know. Whereas with pediatrics, there's milestones, right? So there's all these different milestones that you have to know the information for. What are their vital signs? Where should they be cognitively? Where should they be developmentally? Like going on and on and on and on. That is really, really difficult because there's just a lot of information in each section that you would have to know. So personally, peds wasn't great in that section. Hi, Noi.
Alicia on TikTok asked and say she start nursing school tomorrow. Do you have any advice? She already have 11 assignment due on Tuesday.
Oh no. Sounds like you're in an accelerated program. So Alicia's in nursing or starting nursing school tomorrow. She's already got 11 assignments due on Tuesday. It sounds accelerated. So here's my thing. Get you a really, really good planner. If you don't already have a really, really good planner, you need to get it now. I would assume at this point you probably have a syllabus, which is the reason why you know that you have 11 assignments due on Tuesday. Go through that syllabus, get your really nice calendar and write down everything. I'm talking about when your labs are due, when your sims are due, when you have exams, when you have assignments due, when you have papers due, whatever it looks like. Also write down your personal things. Do you have birthdays that are coming up? Do you have anniversaries or things that you need to celebrate? All of that stuff, right? Write all of that down and get really good at time management, because nursing school is going to throw you for a loop. It is one of the hardest programs out there. It was like voted one of the most difficult programs because you're learning so much information in either a 2 or 4 year span, depending on which degree that you're going to get. So the quicker you can get ready with time management, the better off you're going to be. Do not procrastinate in nursing school. You will fall behind tremendously. The other thing too is studying. So you have got to figure out how to study, because studying for your prereqs is not going to be the same as studying for your nursing school classes. I'm just going to tell you up front, you have really got to key in on critical thinking and what is happening with the patient. You need the whole picture of what's happening in disease process and pathophysiology and simulations. What could go wrong? What could go right? How are you going to fix the things that go wrong? What could be detrimental for the things that go wrong? So you've got to change the way that you think when it comes to studying, because memorization, I'll tell you right now, when I was in nursing school, we had probably 3 girls that memorized everything and passed with straight A's. Let me tell you what they're doing right now. They're not nursing. You cannot memorize that information and expect that you're going to be able to translate that when you go into the nursing profession, because they struggle. Because they're like, well, that's not textbook. Well, guess what? Nursing is not textbook. Nursing school teaches you how to pass the NCLEX. It does not teach you how to be a nurse. So you've got to put a little bit of time into figuring some of that stuff out, that critical thinking beforehand, or else you're going to be in the weeds. So that would be my biggest advice. Get good with a good calendar. Get that time management under control. Do not procrastinate and change the way that you study. Trust me, it's going to be tremendous for you. And then same thing for Chemi Boo. I see that you asked kind of the same question starting nursing school soon. Same advice goes to you. Oh no, Noy's daughter moved to college.
More
Who
time for
who are
us.
you gonna chauffeur around now? Hey everybody.
Betsy
Uh-huh.
on TikTok passed her ATIT with 90.7, 100% of the math portion because of us.
Betsy, I just passed my T's with a 90.7, 100% on the math portion because of you. Huge congratulations to you, Betsy. I'm so incredibly proud of you. First of all, 90.7. Can I get some thumb clicks, whatever you want to call these things? I don't even know what these are called. Snaps. Can I get some snaps in the chat? That's great. Huge congratulations to you. I hope you took some time to celebrate because that is an incredible score.
There's a couple people start A&P 1 or 2 starting tomorrow. One of them in particular in 5, like finishing 5 weeks advance.
It's taking A&P in 5 weeks?
Yeah, they finished
Oh,
A&P 1 or 2.
So you're doing like a half semester.
Yeah.
So advice on A&P?
Yeah, how to do A&P 1 or 2 in 5 weeks, or what study plan, or what is important to know.
So here's the deal about so a lot of people are in the process of going to A&P, and they're asking about advice for anatomy and physiology, what they should do. And there's one particular person that's doing it in 5 weeks. So you can do it in 5 weeks. I just find that sometimes it can be a little bit difficult to learn everything in that short period of time, which is why I took the full semester of A&P. But it's not unreasonable. You can do it. Here's the deal. A&P, you have got to pay attention in A&P. If any other class you didn't pay attention to, or you just kind of like muddled your way through, A&P is not one of those classes. Because if you are planning to go to nursing school or a school that requires you to really know anatomy and physiology, then you're going to be in a heap of trouble if you don't already know it, because your nursing professors are going to say to you from day one, I am not here to teach you A&P. They will not teach you A&P at all. They're going to talk about the disease processes and what's going on, but they're not going to really give you the nitty-gritty of A&P and what's happening pathophysiology-wise when it comes to disease processes. So you have got to pay attention in A&P, really know it front and back in order for you to be successful when it comes to nursing school. Now, when it comes to the actual classes themselves, my biggest advice for you is to really study the number one, what the system does, what the main function of the systems are, how they affect other systems, because let's be fully transparent, other systems are going to be affected. They are all interconnected, they all work with each other. Number two, know like if something within the system was to break, is there a secondary system that's going to kick in and that's going to take over? If that system fails, is there nothing else that's going to take over? What's going to happen to the patient, right? Think about things like that. You've got to really build critical thinking when it comes to A&P, because once you get into the nursing program, you're going to start to realize, oh, okay, so this is what's happening in the system. So if the system breaks, like with heart failure, right? With heart failure, if my system breaks, my cardiovascular system, this is what's going to happen. We're going to start having backup in the system, right? We're going to start to see patients on certain medications try to get rid of the backup. If those medications don't work, what are other options of the system? What's happening with the heart? The heart's not contracting appropriately, so that means the blood's not flowing. Those are things that you're going to start to learn when you go through A&P and when you start learning the disease processes. So really get into the nitty-gritty of each system and what's going, because I'll tell you, your teachers are not going to teach it to you. It's going to be really, really important. Do I have any study tips for microbiology? Great question. So with microbiology, You're doing a lot of like microorganisms. You're learning about all the different microorganisms, all the different like Hawkeyes, staffs, rods. You're learning about all the differences. So those are going to be very important when you get into nursing school too, because certain things, if you ever heard of MRSA, right? MRSA is methicillin resistant Staphylococcus aureus, which is a type of microorganism that's resistant to certain types of antibiotics. So when you start getting into those topics, you're going to go, oh, okay. So those particular microorganisms that cause this are the big key players that are the problem, right? So um, really understand specifically the organisms themselves when it comes to microbiology. Studying shouldn't be too difficult because a lot of the systems kind of follow the same or not systems, but a lot of the microorganisms kind of follow the same thing. So if you're good with like your medical terminology, with understanding what the difference between like clusters and rods and circles and things like that, I think you should be pretty good. Microbiology was really fun for me. I didn't find it too difficult. Full semester is totally worth it versus cramming. I'm about to start A&P too. Yeah, I completely agree with doing a full semester of anatomy and physiology because let's be fully transparent, it's just a lot of information. And if you try to cram it and you're trying to memorize it, you're putting yourself kind of like at a disservice. Do you have any tips on study advice for fundamentals? Ooh, great question. So when it comes to fundamentals, this is the semester where it's going to make or break you as a nursing student, right? Because you are now having to figure out how to study differently, right? You're not able to necessarily memorize information anymore. You're going to have to start applying information. You're going to start looking at like your Maslow's hierarchy of needs. You're going to start looking at your ABCs. You're going to be looking at like infection prevention and control, different vital signs. You're going to be doing a lot of simulations, right? A lot of different kind of simulations, usually kind of like health assessment simulations, things like that. So when it comes to fundamentals, same thing. Make sure you have a really good calendar so you can save all of that. But specifically when it comes to studying, understand your Maslow's hierarchy of needs and your ABCs are going to be really the most important because that's going to dictate how you answer the questions when it comes to your test. If you can figure out what's priority over something else, that's going to help you tremendously. Really make sure that you are honing in on like vital signs and patient care and health assessment, things like that, because that's going to carry over into your medical surgical classes, mental health, labor and delivery, pediatrics, all of that's going to carry over. So be prepared. You may even have pharmacology your first semester. Every school does it a little bit differently with the way that they present pharmacology. Some will give it to you in one semester, some will break it up over multiple semesters. So my recommendation to you is learn with pharmacology the grouping of medications. So your beta blockers, your calcium channel blockers, your diuretics, loop diuretics, thiazide diuretics, loop them together and what they do and recognize what the medications end in, right? So the medications that end in LOL are usually your beta blockers, right? So even if you come across something, you're like, atenolol, what the heck is that? You'll know that it falls under the beta blocker group because it ends in LOL. So start looking at patterns, especially when it comes to pharmacology. It'll help you tremendously. Everybody's like, it all sounds so scary. It's not scary. The thing, I just want you to be prepared when it comes to nursing school because I went into nursing school because I didn't have any mentors. I didn't really have people that were there to tell me what to expect when I started. And I went into nursing school expecting, oh, this is going to be great. I'm just going to like memorize the information and they're going to teach me everything I need to know. And then I got in there and they were just like, we're not here to teach you anything. And to be honest, not all teachers are like this, but my specific teachers are like this. And there are still some people out there that are like this. They don't really teach, they just read from the PowerPoint. And I struggle with that because if it's just reading from the PowerPoint, I can do that, right? I want to learn why different things are the way that they are. And that's the reason that we're going to be doing more nursing school content and what's happening with different disease processes and things like that, because you may get stuck with one of those professors that just read from the PowerPoint, unfortunately. And you are going to have to learn how to teach yourself how to study. And then we're going to have videos coming on that out on that too eventually. You're going to have to learn mnemonics, study tips, just the same stuff like we do with T's. You're going to have to learn all of that. And unfortunately, sometimes nursing programs don't give that to you. So I just want you to go in with the correct expectations of what to expect, then getting in there thinking that, oh, this is going to be easy and that my teacher will teach me everything. Because even when you ask questions, a lot of times they may not necessarily know the answer to it. And you may never know the answer. They're going to ask you to look in the book. Let me tell you, how many times I've had a professor say, look in the book, drove me insane in nursing school. So I just want you to be prepared for that you're kind of going to be a little bit alone when it comes to your studying, and that's okay. That's okay. We just have to figure out the way to study to get us there.
Someone suggests read before lecture or else you get behind on TikTok for everyone Coco.
So here's what I did. So somebody said read before your lecture so that you won't get behind. I agree with that halfly. So I think the thing is that when you read from the textbook, you tend to get overwhelmed because the textbook is usually ridiculously huge and it's full of a lot of information that's not necessarily important. So my recommendation is like before you start class is to read what the main chapter pieces are about. So usually at the beginning, it'll go over like a summary of what's going to be covered in that chapter, what that is about specifically. And then as you flip through the pages, you'll see like little boxes that'll give you like main things that you need to know about certain things and so on and so forth. And then even at the end of the chapter, they'll have like little chapter summaries of like key topics. That is where I would read first instead of the whole textbook. If you're good with reading the whole textbook, fantastic. I'm the type of person that can't learn reading from a textbook. So what I did is I looked up like videos or lectures on those specific things, like the key summaries at the beginning and the end of chapters, and then whatever was in the box. And that was how I learned. I looked up those lectures to get the the visual audio piece of it, because what I do is I'll probably read for like 10 minutes and I've forgotten everything that I read. But if I hear it and I see it, I tend to keep it longer. The other thing that I would also recommend too is to do active recall. So after you've read a chapter, get either like a blank sheet of paper, a whiteboard, whatever works best for you, and start writing down the things that you remember based on that chapter. Write down everything you could possibly remember. And then once you can't remember anything anymore, go back to your notes, see what you missed. That's the stuff you need to continue studying because that's the stuff that you forgot. That would be my key thing. So yeah, absolutely read like the important pieces before you go in so you know what to expect. But I would really start looking for videos and auditory types of learning, because I know that a lot of you out there, if we were to do kind of like a test to see like what your way of learning was, a majority of you are probably going to be audiovisual, tactile learners. I hate it when you ask them questions and they don't want to answer, but when they do, it's like essay format where I don't understand what they're saying. And that's the problem. I think there's some people that have probably been in the nursing school profession as a teacher for probably a little bit longer than they should have. I feel like when you take yourself away from what's actually happening in healthcare and what the new and latest and greatest things are, and how healthcare is practiced now. I had a professor recently, I won't say where it was, but she was still teaching that you blow up the balloon on a Foley catheter before you insert it. That is no longer best practice. There's a lot of articles that have come out and have talked about how inserting a Foley after you've blown up the balloon is damaging their urethra, but they're still teaching that in skills labs because they want to make sure the balloon is intact. But you don't need to worry about that because unfortunately it's Better to have a balloon that's not intact than to insert it into your urethra and then you damage the urethra. So I think when people are removed from that kind of setting for a period of time, it tends to put them at a disadvantage because they're not witnessing what's actually happening in healthcare, and they're just repeating the same things every semester because they've just become accustomed to it. So I think that unfortunately it does put you at a little bit of a disadvantage, which is why so many people turn to YouTube and things like that to try to find people that will teach them concepts that are accurate based on the most current standards when it comes to teaching, unfortunately.
So we going back to T's. When is the when to start studying for the T's and how?
So when to start studying for the T's? As soon as you can. So here's the deal. Number one, you need to make sure that your school is actually requiring the T's because not every nursing school or every program, whether it's sonography, dental hygiene, echo, cardiology, whatever it is, not all of them require T's. Some of them use different tests. So this is what I would recommend. When you know you want to enter one of those programs, look at your school options and what their requirements are. If they require you to take the T's, great. Now, I would tell you that if you know now and you've got 2 years of prereqs ahead of you, start studying now, right? Start really getting into what it is. Because the T's isn't going to change that much in regards to the material it's covering. It may just change the way that you are learning or having to answer the questions. Do you know what I'm saying? So the T's is always pretty much covering the same topics in general. There might be like one or two things you have to learn, but the quicker you start learning now, the better off you're going to be. Same thing when it comes to the NCLEX when you're going to nursing school. If you start studying for your NCLEX on day one, you're going to be at a bigger advantage later on in life when you have to take it at the end of your 2 or 4 year program. So the sooner you can start studying, honestly, the better. Is it true that the T's is harder than the NCLEX? Oh, that's a great question. So here's the deal. Let's talk about the time period we have when it comes to studying T's versus studying NCLEX. So when you find out you have to take the T's, usually, not always, but usually programs will say you've got a week, maybe a month, to take your T's. So you're trying to cram reading, math, science, and English all in a period of what, a week or maybe a month? Some of you even longer if you started to prepare ahead of time. But I mean, that's a lot of information in a short period of time when you think about it, right? NCLEX, you're studying for that continuously for 2 to 4 years, depending on which school you go to, right? So every semester, especially now, if you're going to a school that requires T's, you're most likely going to have to take an ATI predictor every semester. So at the end of each semester, like ATI fundamentals, ATI med surg, they're all a little bit different. But you're taking a predictor every single semester to prepare you for the NCLEX. So you've got at least a minimum of 2 years of studying for that test. So is the T's harder for the NCLEX? When you think about the time period that you have to actually study for it and pass it, yeah. At the end of the day, the T's would be harder than the NCLEX because you just don't have the amount of time that you think you do. Now, if you study for the T's for 2 years, you're most likely going to be a little bit more successful, right? Than if you only had a week or a month, but you just have to take that into consideration when you're thinking about the difficulty. See, and Krista's school uses Kaplan. So that's like another thing, right? Every school uses something a little bit different. If a professor posts a lecture slides early, would it be better to pair it with the textbook? I mean, you can. If your professor posts the lecture slides before your lecture to kind of like give you an idea of what it is that you're talking about that day, could you read it in addition to the textbook? You absolutely could. If you are a big like textbook learner, then that's your jam, right? But with me, whenever I was trying to learn, like say for example, my professor gave me a lecture on urinary incontinence, right? And what that kind of looks like in a patient. I could look at the textbook. I could look at like the front of the textbook. I could look at the back of the textbook. I could read like all the little things that we talked about before, but I didn't necessarily think that I learned that way. I end up what I do, if you're like me, you end up highlighting most of the book because you're not really sure what's important and what's not important. So with me personally, what I did to save time was I looked for video lectures, is what I did. Just because I wanted to have some kind of lecture before I went in to nursing school to help me kind of try to figure that out, figure out specifically what it is that I needed to know. That would be my recommendation when it comes to how to prepare beforehand so you have a little bit of an idea. But here's the deal. If you're just a visual person, you can read a book, fantastic. If you're a auditory person, listening to a video's going to be great, right? Tactile person, we're all a little tactile. Let's be 100% transparent. Do your active recall, write on your whiteboard, write on your blank of white sheet of paper, and write down what you know and what you don't know. Trust me, it's going to help you tremendously. But yes, can you read the textbook? Absolutely.
Recommendation for CME credit for license renewal.
Like who to use for it?
I guess so. I mean, it's on Facebook, I think.
Recommendation for CME?
Yeah, credit for license renewal.
There's a whole bunch of companies out there. I personally use. Hold on, I gotta look it up. Yeah, I personally use Elite Learning. Is who I by Colibri Healthcare. That's who I use to renew my stuff with. They're really, really good. They're very like straight to the point, so that I'm not having to kind of like figure out like what it is that I specifically need to renew my license. They're very straight to the point. That's who I personally use. Do I help with NCLEX PN? I will eventually, but not yet. I'm slowly working my way through NCLEX RN and then NCLEX PN. I mean, you won't learn a lot of the same things that RNs do. You just learn it either at a different scope of practice because you have a different scope. PNs have a different scope from RNs, or some of the stuff you don't learn at all because some of the things are just like specific to RN. So some of it will apply to you, but yeah, eventually I do want to do NCLEX PN specific stuff.
So, someone want a suggestion for first semester in nursing school and how to organize between classes.
So help with first semester of nursing school and how to organize between classes,
Like many classes and other stuff.
like in the same semester or like
Yeah,
in
I think
between
so.
semesters.
Between same semester. Like literally first semester advice, I think.
So this is what I will say when it comes to organizing like with multiple classes cuz a lot of you may be taking like fundamentals and pharmacology at the same time your first semester, or if you did like a concurrent program like I did, I had to do fundamentals, pharmacology and health assessment. My first semester, it was a lot. Um you will not have a life in nursing school. I hate to say it, but it's true. Is that you won't have a much of a social life in nursing school. You won't be able to attend a lot of family functions. You won't be able to probably go out as much because you're really going to have to be honing in on your nursing school classes in order to not fall behind and to not fail. Can you still do fun things? Absolutely. I'm just saying that at the scale that some of you may be doing it now probably isn't going to happen. When it comes to organization, really, really good calendar. So you could literally get anything. There's like not something specific that I would recommend that you get, just something that has a 30-day calendar and maybe even like an individual day calendar so that you can write out all your stuff, all your classes, when your exams are due, and things like that. You have got to work ahead in nursing school or you're going to fall tremendously behind. So, for example, if you know you have an assignment due next week, do it the week before, right? Do it the week before. Get it done so that way you're already a week ahead. If you finish all your studying and all your assignments for the next week, Move on to the week after that. The quicker that you can get certain things done, because let's be honest, a lot of those assignments are not going to be relevant when you actually get into the nursing career. The quicker that you can actually get the assignments done so that you can actually spend time on the things that are important, like studying the concepts and learning, the easier it's going to be. You have got to be ahead when it comes to nursing school. You're going to fall tremendously behind. When I was in fundamentals, I almost failed. I'm going to be fully transparent with you. I almost failed fundamentals because number one, I was taking fundamentals, pharmacology, and health assessment. All three of those classes were in person. I had to physically go to those classes, and I did not have good organization, right? So I was just trying to fly by the seat of my pants when it was, trying to figure out how to organize for my classes. And I was always doing my assignment the day before it was due. I'm telling you right now, don't do that. You're going to hurt yourself in the end, and you're going to put yourself in a really bad situation. You've got to start preparing at least a couple weeks before you go to nursing school. As soon as you get those syllabuses for your first semester, that is your opportunity to go, okay, time to buckle down and boots to the floor because I've got to start getting ready for this. The quicker you start doing it now, the better off it's going to be. If you're the type of person that has an eidetic memory and you can you memorize everything and pass your exams, fantastic. But most of us don't have that. So you have got to lock in as soon as you get that syllabus and start organizing what you've got and start working way ahead. Once I figured it out, I was always working like 3 weeks ahead. As long as I had the information, I was submitting assignments way early because I didn't have time between clinicals. Clinicals sometimes are 8 hours, y'all. Sometimes it takes up a whole day. So that's just 8 hours of your time you've just lost. Simulations sometimes could be like 4 hours or more. I had one simulation that was 6 hours that we were there. And it was just because there were so many of us rotating through the sim, right? Classes can be 4, 5, 6 hours a day, right? So you're already having issues with time management because everything just takes so much time. The quicker that you can get this stuff done, the easier off you're going to be. I plan on not having a life in nursing school. Yeah. I did not have a life for nursing school or my master's, if we're being fully transparent. If you obtain a CNA license, will you advance in nursing? Will it help you when it comes? Here's the deal. Let me say this. So, will obtaining a CNA license advance you in nursing? No. Will it help you with your applications because they see that you have a license? Yes. But what will actually help you advance in nursing with a CNA license is actually working as a CNA. So if you're actually on the floor witnessing what is happening, especially in the hospital setting, if you're witnessing disease processes and how people deteriorate and how we fix certain things that are going on, I think that will help you more than anything else because that's real life experience. I think that having worked as a CNA or a PCT or an advanced nurse tech or whatever it looks like, right? Having worked in that kind of setting will help you tremendously because you have real world experience, right? You've experienced it, you've seen it. And that makes a huge difference when it comes to nursing. And it's going to make you a tremendous nurse. Why? Number one, you're going to appreciate your CNAs, right? I can't tell you how many times I've had to have a discussion with a new nurse that said, oh, I don't wipe butt because that's not my job. Guess what, honey? It's your job and you need to help your CNAs. Because if you piss your CNAs off, you ain't going to have CNAs. And they're not going to want to work with you. So having worked as a CNA, I think it gives you a kind of like a wake-up call with how important CNAs are when it comes to the healthcare system and how it runs. And it will help you tremendously advance in nursing because you'll have the real life experience and you'll appreciate them more. Did I do my BSN or ADN first? So I did them concurrently. So at the school that I was going to, I went to Seminole State College and UCF, and they have a concurrent program in Florida where you can do your bachelor's in a matter of 2.5 years. That just basically means that you're going to take all of your associate classes and all of your bachelor's classes at the exact same time. So I technically got my ADN first, but then one semester later, I finished with my BSN. Highly recommend that if you have a school that does a concurrent program and you are able to do it, do it. Get it over with. At the hospital, I see nurses doing everything. Yeah. And listen, and it doesn't happen all the time. I don't want to say that every graduate nurse comes out and acts like that when it comes to CNAs, but there was one or two here and there that they did not realize that when they were going through nursing school that was going to be a part of their job. You can't go into a patient's room and the patient says I need to use the restroom and then you leave to go find the CNA. That's not how it works. Right? That's not how it works. You've got to help out too. Because if your CNA loves you, they're going to take care of you. If your CNA doesn't love you, they're not going to take care of you. And you do not want to be on a CNA's bad side because they will make or break your shift.
So what do you recommend to prepare when it comes to nursing school exam and quizzes? And how to prep for that?
Great question. So what do I recommend to prepare when it comes to nursing school exams and quizzes? There's a couple different things that you can do. We talked about active recall before. I think that's going to be tremendously helpful for you. The sooner that you do active recall, you should be doing it every week, to be honest with you. You really should be looking at what your upcoming exam is and really start learning those things. Start doing the active recall, writing it down, seeing what you're missing, and going back and studying the stuff that you don't know. What I will tell you is that a lot of the times, not all the time, but a lot of the times, there's going to be a lot of information that's going to be on the exam that's missing from the cheat sheet / study sheet that the professor gives you to help you study for the exam. So I wouldn't go 100% off of what the instructor gives you as what's going to be important on the exam, because at the end of the day, all of it's going to be important. They can test you on everything. And sometimes they tend to leave things out to see if you're really studying and getting the information that you need to know. So really look to see what specific chapters or topics are going to be covered on the exam, and then get a good foundation of that information. Look at your notes, say them out loud, okay? Teach them to your partner, to your dog, to a teddy bear, to the wall. Teach it to a stranger. Sometimes strangers might laugh at you a little awkwardly, but teach it to them. Who knows, right? Just like teach it to somebody. Speak it out loud, because the more that you speak it out loud, the more that it's going to stick. And a lot of times when you're taking your exam in the classroom, you're going to hear somebody talking to you, either yourself or somebody else where you were teaching it, right? Don't second guess yourself when you're actually taking the exam. A lot of times our gut was right the first time, and our minds try to play tricks on us to tell us that the other answer was incorrect. Unless you know with 100% certainty that that other answer was right and you picked the wrong one, don't change your answers. Because what's going to happen is you're going to get outside after your exam, and you're going to be talking to your friends, and your friend's going to be like, oh yeah, I picked that for that question. And you're going to go, oh, I picked that and then I changed it. It happens every single exam. Trust me, you're going to be hearing me say this to you when you take your first exam in nursing school. It happens every single time when you change your answers. Don't change it unless you know for a fact that it was right. I always recommend doing practice questions before your exams. So there's a ton of them out there. You can, I use the Sanders NCLEX RN book to help me with practice questions on different subjects. Highly recommend them. They're really good. But I did a bunch of practice questions to kind of try to figure out like what they were going to ask, how they were going to ask it, things like that. So that would be my recommendation. Practice questions, active recall, speaking it out loud. Don't change your answers. I'm a lab tech. I take my T's in a month. OMG, I'm really nervous and binge watch. Any tips? If you haven't already, Hero Force, take a practice test first. Take a practice test first. see kind of like where you are struggling with, what's more difficult, and then spend 80% of your time studying the things that were more difficult and 20% of your time studying the things you already know. Because all of it's going to be important when it comes to the test, but really hone on the things that you don't know. Because when you study the things you don't know, you ultimately boost your score up, right? It helps you boost up your score. But if you keep studying the stuff you already are really good at, you're not improving in the areas that were more difficult. So that would be my biggest recommendation. Take the practice test, figure out what's important for you to study, and then do that 80-20 split. I'm doing an internship in a hospital and they're always rude towards our CNAs. And yeah, and if you look at situations with the CNA, they're usually not very helpful and then they get in trouble, but a lot of times it could be either way. It could be that the CNA just has a bad attitude. Sometimes that happens, or it could be that the staff just mistreats the CNA. So it's healthcare is a team, right? Healthcare is a team effort. If we want to have a good shift and we want to excel, we've got to have all the key players of our team in order to make that happen. So if we treat each other badly because maybe we're having a bad shift or maybe something is like negatively happening at home, of course, right? Of course, we're going to have situations where we're not going to have a good shift because we're just angry and yelling at each other all the time. Don't make that you. Treat everybody on your healthcare team as they're equally important.
So there's a longer one.
Uh-huh.
I know in CA, after the first semester of the RN program, you can work as a CNA.
Mhm.
Is it doable not only for the experience, but time-wise, being a nursing student between classes and clinical?
That's a really good question, actually.
Yeah.
So somebody asked, in case you didn't hear it, basically the cliff notes of it is that after you finish your first semester, you can work on the hospital setting as usually they put you in like a nurse technician role because CNA is saved for people who have actually received their license. So usually they put you in like kind of like a nurse tech position role after you finish your first semester. And they're asking, is it feasible, really, based on like the time commitments and things that you're going to need for nursing school, as well as the time commitments that you would have to spend working? So, this is what I will say. I personally did this. So, in my second semester of nursing school, after I finished my first semester with all of like the fundamentals, pharm, and the health assessment, I applied to be a nurse technician on an oncology unit on nights. Full time, because I thought it was doable. What I will tell you is that everybody's experience is going to be very different. I personally couldn't do it because number one, I was working nights. So I was working 12-hour shifts on nights 3 times a week. They were very helpful. It wasn't the unit. The unit was very helpful in trying to give me shifts that was around my school schedule because they recognized that I was in school. But sometimes I would have to work a night shift where I would have to go to class the next day. So I would work a 12-hour night shift, have to leave work and then head directly to class, spend like 6 hours in class. Hopefully, fingers crossed, not have any like simulations or things like that, and then go home. And I was just horribly tired. I wasn't able to do anything else. So I did that for probably, I want to say I did that for like 2 or 3 months. And then at one point I said, you know what, enough's enough. I can't do this anymore. So was there other people who did that and worked full time and was fine? Yeah, absolutely. There was a bunch of people that did it, but I personally couldn't do it just simply because I was going through a concurrent program, which I was already taking extra classes on top of nursing school. Nursing school is hard enough. Now I was taking extra classes in nursing school. So it just didn't work feasibly for me. And I was in a financial situation where I was living with my parents and they were helping take care of me while I was going through nursing school. So I didn't have to really worry about it too much. And I didn't have any like big financial commitments that was going to affect that as well. So, can you do it? Absolutely. There are people that have done it, but just expect that your professors and advisors are going to tell you that you're not going to be able to work through nursing school because it's just, you're going to have a lot going on in a short period of time. So just be prepared for that in case, it is something that you get into and then you realize it's just not feasible.
Have you seen Or what's your suggestion of advantage and disadvantage being a male nurse?
What is the advantage and disadvantage of being a male nurse?
Yep. Seen, heard, personal point.
What is the advantage and disadvantage of being a male nurse? Well, you're in a female-led industry, my friend, being a male nurse. So you've got your pick of the litter, as one would say, if you were wanting to marry another nurse. First of all, as a female nurse, as long as you're like a fantastic male nurse, they're all gonna love you and they're gonna take care of you. Most of nursing, not all of it, but most of nursing, I will tell you, is made up of a lot of Filipino women, a lot of Latina women, and then the rest of us are kind of all mixed in there. And if you're a male nurse, hear me out. If you are a male nurse, they are going to take care of you, Poppy, like you have never been taken care of before. I'm going to tell you right now, you are the baby, you are their daddy, you are their work husband, you are everything. So, advantage wise, you're going to have a huge advantage when it comes to healthcare because you're in a big women led industry. Disadvantage, you're going to be wanted for everything. So I need you to lift my patient. I need you to put my patient in the back and you help me. Um, you're gonna be like you could be like the mediator of a lot of things that are going on. I mean, as a male nurse, you're in it. You're in it to win it. I would tell you there's more benefits than cons when it comes to males in nursing, but it's all in how you look at it. I'll tell you right now that I've worked with some incredible male nurses. They're absolutely fantastic. I think more men should be nurses in this industry, if I'm being completely honest, because it would definitely help take a huge load off of us having you all there. Because let's be honest, y'all got muscles. I ain't got no muscles. Okay. And when I need some help lifting some patients up, I call my men. They come in and they help. But yeah, you're gonna be taken care of in healthcare. I'll tell you that much.
But don't mess with Filipino mama, whatever. They will talk. So
Oh
don't.
yeah, and don't be messing with Filipino women. I'm gonna tell you right now.
Or Asian in general.
Asian in general. Don't be messing with the Asians because if you
If you decide to date
here's the deal. No,
ooh.
not so much the dating. If you backstab an Asian person, be prepared for the consequences. Be prepared because they will be your number one fighter. I can't tell you how many times I got into arguments with physicians, and my 60-year-old Filipina charge nurse was like, hold on, boo boo, I got you. And she would call, like if you watch Nurse John is a fantastic example of this. She would call and call them out on everything because they've been on the floor for a long period of time. They don't tend to change floors. So they've witnessed people go through residency a lot of the times and the stupid mistakes that they made. So when they yell at you, they are the first person to let them know what's happening. Oh, do you remember when this happened when you were a resident? Okay, well then obviously, they will let you know. They're not going to back down. But if you piss them off, they ain't having your back. So take care of your Asian nurses that you're working with because they are feisty. Latinos too, because I worked with a lot of Filipino and Latino nurses. Take care of them because they will have your back. They will be there for you. But as soon as you backstab them, don't expect that they're going to come back to you ever. Ever, because they're going to remember everything. And some of them hold grudges. That's all I'm saying. But they're fantastic. I love each and every single one of them. Yeah. And whatever you do, don't date them because you're dating around. Because as soon as you break up with them, everybody gonna know. Everybody and their mama's gonna know. Because they're going to tell everybody, and you are going to be blacklisted from a lot of nurses. Word will go around very quickly. I'm going to tell you right now, I've heard some stories. It's so bad to the point that like people had to quit the hospital because they kept dating around, didn't learn their lesson the first time. Be in it for the right reasons. Don't lie and say that you're trying to be exclusive and then end up not being exclusive. That's all I'm saying. Filipinos are good people. All the Filipinos I work with are awesome. Yeah, they are. They're fantastic. But they will let you know. They will let you know. And I can say that, one, because I'm married to an Asian, number one, and number two, I work with a whole bunch of them. And I've witnessed it. Yeah, so don't be messing with the Asians and the Latinos. They'll meet you in the parking lot. Oh, goodness. Have I heard of the NEX exam? I have, but it's like a newer exam for me. It's not, it has, I don't think it's been out as long as the T's has. To be fully transparent, I couldn't honestly, don't quote me on that, but I'm not 100% familiar with it. Now I want to listen to your love story. Who, and me and Mr. Cheung? It's really boring. You don't want to hear our love story. It's really boring.
So, someone say haven't seen you for so long on YouTube. Just now. Yeah.
I haven't seen you so long. I'm in my third semester of the nursing program. That's great, Aaliyah. I start tomorrow. I'm going to be taking AH2 and Peds. I'm so excited for Peds. Thanks. That's the field I want to go into. That's so exciting. First of all, be ready for Peds. We were talking about it earlier. You're going to have a bunch of different subsections of ages, and there's going to be things you have to know for each. Vital signs for each age group, milestones for each age group, all of those things. So be ready. Those first 28 days until 18 years, there's a lot going on in the peds section. You'll learn about babies like the first 28 days in your mother baby class, if you haven't taken it already. So many affairs in the hospitals. Let me tell y'all, if you are not a dramatic type of person, very like serious person, very like to the point, I'm not trying to make jokes, it may be very difficult for you to acclimate to the hospital setting because nurses have a very warped view and personality when it comes to healthcare. Why? Because the things that we see could be traumatizing to most of the public, right? You see people dying. You could be taking care of a patient at 8 a.m. and they die at noon, right? It just happens. Like it's just part of healthcare. Unfortunately, people deteriorate. You're going to see people in domestic violence situation. You can see children that have been in situations that they should never be in, right? You're going to witness things that are going to tear you up. And that's, I think, the reason why nurses have developed this kind of warped personality and viewpoint, in that we laugh at a lot of things that may be deemed inappropriate because we're just literally trying to get through healthcare and try to get through our shift and not let it affect us mentally on the other side, right? And what happens when you're in that situation is you tend to cling on to other people that are in that situation with you, right? So like Mr. Cheung, I could tell him stories all day long about what's happening in the hospital, but unless he's experienced it, he really doesn't quite understand what I'm going through, which is why having your nursing besties are going to be number one when it comes to your life. You've got to have people that are experiencing the same things that you are experiencing, because nobody else is going to be able to understand you like other nurses will, right? So when that happens, and when you don't feel heard or you don't feel seen, whatever it looks like for you, nurses tend to date other nurses, and nurses tend to date other doctors. And a lot of times those people are already married or in committed relationships. I can't tell you how many times there was one doctor at his hospital I worked at, that hospital will remain nameless, that he was dating one nurse on every single floor. Every single floor that he was visiting, one nurse. I think he was in like 7 relationships. It was ridiculous. And the only reason they found out about it was that he was speaking at a company, like a town hall that we had, is what they called it. He was speaking at it, and some of the nurses started talking and then realized that he was dating multiple people. That doctor no longer works at that hospital. He ended up leaving. But it's just like affairs happen constantly because we're just trying to cope with what's going on. And who better to cope with than somebody else that has experienced it with you? Not to say that I'm going to leave Mr. Cheung by any means. But if I have a really traumatic experience, you never know. Huh?
No.
No, okay.
So someone asked, how do you deal with your first death that you witnessed? I am a MA and had a hard time leaving work at work. Then she said
Oh, where is that at? Because I want to
on
read
YouTube.
on YouTube. So this is a great question. How do you deal with your first death that you witnessed? I'm a medical assistant and I've had a hard time leaving that at work. So what I will say is that deaths are always difficult. The one death you will always remember is your first death that you've experienced because it's always going to stick with you. What I will say, and I hate to say it like this, at some point it will get easier. The more that you see it, unfortunately, it will get easier. You will start to cope with death. But I think the thing is, initially, when you're dealing with it, is allowing yourself to cry. I can't tell you how many times I've cried with families where I didn't even know the patient. And it's just because death is so hard. Because if you think about this person had a life, they had goals, they had dreams, they had values, they had family. But I think that the biggest thing that helps tremendously is you have to look back and see that what you did was enough. Because I think what happens is sometimes, and I do this a lot with my new graduates when it happens, is that sometimes you think that, oh, maybe I could have done something else. Maybe I could have like paged the doctor sooner, or I had done this, or I could have done something differently. And I'm going to be 100% transparent with you, boo boo. You couldn't have done anything differently. There's nothing that you were going to be able to do or look back on or regret that you should have done that would have changed the outcome. So you have to leave work at work. I know that's hard, but you have to know in your heart of heart that you did everything that you possibly could for that individual. And you just have to respect that individual. Do you know what I'm saying? Respect the body. Respect what happened. Respect the fact that this was a person and it's not just like somebody who passed away, right? I think that's like the biggest thing that helps with coping when it comes to death. It will get easier. The first one's always going to be the hardest. Allow yourself time to grieve, allow yourself time to cry for that individual, but just know that you did what you could and that you respected that individual and that you provided the best care that you possibly could for that person. And just know that the outcome wouldn't have been different. We actually went through this with my husband's mom because she passed away. Was it last year she passed away or the year before? Recently, she passed away and she had a traumatic brain injury that ended up being an aneurysm that burst. And unfortunately, after it happened, it was a very traumatic experience for my husband because that was his mom. And there was nothing that we could have done that would have changed that outcome. No matter how much you look back on it and you tell yourself, well, maybe I should have called more. Maybe I should have did this, or maybe I should have done that. Nothing's going to change the outcome. The outcome's always going to be the same, right? So you just have to live in the moment now, knowing that you did your best for what you could. And it's okay. And it's okay to grieve and it's okay to miss that person, but you have to leave it where it happened and not let it affect you. Because at the end of the day, it doesn't make you any less of a person because it happened. It doesn't make you any greater of a person because it happened. It just happened, right? So you just have to kind of take that into your heart. Yeah, and I'm the same way, Noe. If I see somebody crying, I'm crying. If we're being 100% transparent. In the hospital, coworkers become family. You get tired together, overwhelmed, and spend holidays together. We're all in the same struggle bus trying to push through. Exactly. And here's the deal. Sometimes that family can also be temporary. So when I was working as a nursing educator at the bedside, as a bedside nursing educator for PCU, ICU in a previous hospital that I worked at, that was my family. There was nothing you were going to tell me otherwise. I cared for each and every single one of those individuals because we went through the garbage and the difficulty together, right? And that's how we made it through. But when I left that position, I have never heard from any of those individuals ever again. Never heard from one. And we were very close. I'm talking like we went out together all the time. I mean, just like we were very, very close. But it's just like sometimes people are put in your life temporarily, even though that bond is very, very strong, and that's okay. So if for some reason, like one day you decided to leave the hospital setting, go do something else, just know that you may never hear from those people again. But the bond and things are still there. It's just unfortunately that's a part of life. That's how we grow. Anything else?
No, I think that's it. I mean, Noi husband,
Oh,
Granny
and I
passed away.
see Noy's husband, Granny, passed away about 2 weeks ago, and we're still feeling it. Yeah, and you know what? You're gonna feel it for a long time. Even though it's been a year, we still feel that loss. Do you know what I'm saying? Like we lost, not that it was a person, but we lost our dog Chuck in May. And I still feel that loss constantly. I can't even go back to the vet that we took him to because it's too fresh. But it's just like you're gonna feel that loss for a very, very long time. It's never going to completely disappear. You just have to be resilient in the fact that you know that you did what you could and that the outcome wouldn't have been any different. Because trust me, I was crying a lot for several weeks after we lost our dog, thinking that we made the wrong choice. But at the end of the day, the outcome wouldn't have been different.
Okay, someone asked, she got 72 on her T's. Any tips on retake for September 9th?
So I got a 72 on my T's. Any tips on my retake for September? So you should have gotten like a printout when you had taken your T's, and that second page on will give you like an idea of the areas that were a little bit more difficult. Spend 80% of your time studying those more difficult areas. Really get into the nitty gritty of what was more difficult in those areas for you. That'll help you tremendously. Still spend 20% of your time studying the stuff that you did well on, but you've really got to boost that score up for your next time around. So it's going to be very important for you to spend 80% studying the stuff that was more difficult in order to boost it up.
All right, I think this will be the final question.
Uh huh.
Someone is about to start surgical trauma ICU. Any advice?
Be prepared. So somebody's about to start surgical trauma ICU. Any advice? So first of all, surgery in and of itself is just wild, right? Because you're going to see all kinds of stuff, especially if it's like a generalized surgical trauma ICU. You're going to see all kinds of things. What's going to be good is that it's going to help you build tremendously on critical thinking because it's an intensive care unit. I think that's going to be very important for you, especially if you plan on going back further to like advance your career to maybe like nurse practitioner or CRNA or things like that. It's going to help you tremendously having that ICU experience. Trauma is fantastic. You're going to see things that are supposed to be in a certain place and they're not, right? When it comes to surgical trauma ICU. So, this is what I'll say for anybody starting any unit as a graduate nurse, be a sponge. If you had already worked someplace previously and then you're picking up a new job someplace else and maybe a different specialty, different unit, don't say we did this way on my other units because what worked for you one unit doesn't necessarily work for another unit. So be a sponge. Ask your questions. If there's some really cool experience going on in the unit, even if it's not your patient, talk to your preceptor and ask them, "Hey, can I go witness this or can I go help with this?" Right? Because that's the only way that you're going to get your experience is if you advocate for yourself. Um when it comes to surgical trauma ICU, you could have 1 to 3 patients, hopefully no more than that. You shouldn't really be seeing any more than that. Be ready for time management because time management is going to be huge. You're going to be dealing with high intensity drips. They're going to have to be titrated all the times. So really just be very prepared for just the chaos, but also the fun of being in an ICU setting because it's going to be crazy, but it's going to be so much fun. You're going to learn so much. But the biggest thing, advocate for yourself. Advocate for you because unless you got a really, really good preceptor that'll do it for you, a lot of times you're going to have to do it for yourself, and that's okay. Anything else? I think we're good.
I think. Oh, someone passed. Oh, Queen K on Instagram passed her T's on Saturday.
Oh, Queen! I watched your videos and it helped me, and I passed my T's on Saturday. Huge congratulations to you, Queen. I'm so incredibly proud of you. It's finally done. It's over. You made it over the hill. Take time to celebrate. That is a huge win, finally being over with that test. But all right, y'all, it is currently 7:05 p.m. Eastern Standard Time, so it is my time to get out of here and have some dinner before I go lay down and enjoy some time with my family. Thank you so much for coming. This was so much fun. Y'all had really good questions. Hopefully, I didn't scare you too much from the healthcare field. Just wanted to set up realistic expectations of what it could look like. That way, you're prepared going into nursing school and then, of course, going into the hospital setting. But to be 100% honest with y'all, nursing is so much fun. Healthcare is fun. It's going to be hard. It's going to be stressful, but it's going to be fantastic. And you're going to have a degree that will take you so many places. If you're like, this job sucks, I don't want to do it anymore, trust me, you are going to have so many more options than what typical people would typically have. So nursing is worth it. I absolutely 100% feel like my degree was worth it with all of the late nights, the no sleeping, the studying, things like that. I did come out on the other side and I am happy with my career. So I hope that you all have a wonderful evening. We'll be back tomorrow with our Teas Live. So tomorrow we're going to be covering science, chemical equations. Hopefully you're super excited and ready for that. We're going to be talking all things marriage, divorce, hoochie mama, wife swaps. If you haven't been a part of it and you're like, what is that even about? Highly recommend that you join, because this is how you're going to remember how to pass certain portions of your ATITs. But otherwise, I'm going to catch you tomorrow night at 7 p.m. Eastern Standard Live. And I hope that you all have a good weekend. Enjoy the rest of your Sunday.